On this episode of Political Personalities with Skye, we're here at the CUNY School of Public Health to talk about startups and accelerator programs in the public health arena. Join me as I speak with Dr. Todd Ellis, principal at KPMG, Michael Short, senior director, Graduate School of Public Health and Health Policy, and Dr. Terry Huang, founder of Firefly Innovations. Let's hear what it's like to incorporate an entrepreneurial mentality into public health solutions.
Public health challenges that we face today are so daunting that no one sector can really solve all the public health challenges we have. So the idea of really creating a truly multi-sectoral approach is really at the heart of what we're trying to do with Firefly Innovations. My name is Terry Huang. I'm the founder of Firefly Innovations, which is a unique public health entrepreneurship platform at the CUNY School of Public Health. At the school, I'm also professor and chair of the Department of Health Policy and Management and direct the Center for Systems and Community Design. I think COVID-19 gave us a window of opportunity to really push forward with this truly multi-sectoral approach. We would not have had the vaccines that we got within a 9-month time span if efforts were not already in place to bring the private sector to the table to work with scientists and policy stakeholders in the public sector in order to accelerate the design, production, and rollout of the COVID-19 vaccine.
You know, it's interesting when you talk about engaging the community. It sounds so simple, but it's complex, and it's not something that has been complex for 2 to 3 years. It's been complex for decades, and rightly so. But we got to get to a point, especially diverse communities, to understand why this is important. If we don't get this right, if diverse communities do not come to the table and participate in these innovations, participate in clinical trials, we're going to be in the same situation 20 to 30 years from now that we're in right now. My name is Todd Ellis. I'm a partner at KPMG with a focus in on IT strategy, and health equity. When you think about pre-COVID and kind of the focus areas, it wasn't really about innovations, technology, how do we reach out to the public and make a difference, right? Move the needle. But COVID forced us to relook at how we engage with the population. Not only looking at social determinants of health, but also political determinants of health, but more importantly, innovation.
My name is Michael Short, Managing Director of Firefly Innovations, the premier entrepreneurship platform of the CUNY Graduate School of Public Health and Health Policy. So the primary program that I'm focused on is the CUNY Public Health Innovation Accelerator. And so far so good. We had record numbers this year. 173 applicants to our accelerator. That's something like 200% increase in the number of applicants. 24 countries people applied from. Unfortunately, we could only accept 8 into the program, so it was very highly competitive, very selective. A number of the participants this year, although they're not located in New York City, we are working with them to launch pilot programs here in the city. So they're doing incredible work elsewhere. We're happy to assist them with expanding their pilots and then proving their product and to be able to expand even further beyond New York City.
Taking all this into consideration, what is the role of our government when it comes to all of this and implementing it for the community? We talk about the private sector, the VC space, the entrepreneurs, the accelerators. What's the role of the government in taking all this into account?
The role of the government should really at the core to do no harm, but to set proper boundaries without being too restrictive on innovations.
We need to support the programs, but we also need to support the entrepreneurs. And that's where KPMG and all the partners that KPMG has I'm hoping that by getting this message out there, we can bring all of those potential collaborators to the table, right? Part of our job at Firefly Innovation is to connect our entrepreneurs to capital. And as I mentioned earlier, it's very hard. If you're a woman, if you're a minority, it's very, very hard to access the standard VC ecosystem. And so we're hoping to serve as that bridge to connect them to capital out there. And that requires lots of different players to step up and say, hey, we believe in this cause, and we're going to join forces to support the programming, but also support the entrepreneurs themselves.
I would love to have this conversation 5 years from now, where we talk about the startups, where we talk about the number of diverse startups, and see that percentage get higher, but also see those startups who are in your, I'm going to call it incubator now, be thriving.
Yes.
Thriving, not ceasing to exist,
Exactly.
but thriving, doing well, have a sustainable business model, and making the impact that we all want. We'd love to have that conversation.
All right, everyone, we'll see you in 5 years.